Mark, there's been a steady stream of people rolling up their sleeves here in Mississauga today, but as the third wave continues to grow, especially in regions like Peel and Toronto, calls are growing louder for the province to divert vaccine doses from the green and yellow zones to the COVID hotspots.
I mean, we might all be in the same storm, but we're definitely not in the same boat.
Dr. Amit Arya, a palliative care specialist here in Peel Region, is one of several GTA doctors voicing concern about the urgent need to refocus vaccine efforts on COVID hotspots. He tells me he's learned from the province's own science advisory table that postal code can be the difference between life and death.
If you were an 80-year-old living in the highest risk postal code in Ontario, your risk of dying from COVID-19 was actually 27 times higher compared to an 80-year-old in the lowest risk postal code. We know that we have gray zones and red zones and different color coding to tell us about restrictions. So that should be used to sort of allocate the vaccines, with more vaccines proportionately going to the areas which have more cases of COVID-19.
The mayors of Peel Region have been calling for more vaccine for weeks now and are still waiting to find out how many pharmacies will be added to the province's vaccine rollout and when they can start taking appointments. According to Peel Public Health, this week the region will be receiving about 10,000 fewer doses than last week. Today, the Premier voiced his frustration over the ongoing supply issues.
I just do not understand how the federal government, they know it's landing tomorrow and they can't give us a time when it's going to land here in Toronto. We just can't snap our fingers to these pharmacies and turn them on overnight.
GTA hospitals are under immense pressure. Patients could start to suffer.
Dr. Warner, a director of critical care at Michael Garron Hospital, also took to Twitter speaking about the need to pivot. To help schools stay open, he writes, vaccinate teachers and staff. To reduce community spread, vaccinate essential workers. To maintain hospital capacity, hotspots need more vaccine. According to the Ontario Hospital Association, more than 400 people are currently in the ICU, and dozens of COVID-19 patients in GTA hotspots are once again being transferred to different areas. This comes as vaccine appointment bookings have significantly slowed, especially in Toronto. Dr. Jeff Kwong, an epidemiologist with the University of Toronto, tells me we need to constantly keep that needle moving.
If it means that we have to lower the age eligibility sooner, then so be it. And then we'll get, as you get down to the 50s and 40s, you'll be hitting a lot of the teachers and other essential workers through that strategy.
Now, according to the province, about 100,000 seniors 80 years and older have yet to book a vaccine appointment. Dr. Amit Arya believes that family physicians should have been a part of the initial vaccine rollout, saying he believes it would have encouraged more seniors to get the shot.